You're listening to Astonishing Healthcare, the podcast hosted by Capital RX, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering the inside baseball on how things truly work, or don't, in the U.S. healthcare system and pharmaceutical supply chain in an astonishingly efficient way.
Hello, and thank you for joining us for this episode of the Astonishing Healthcare Podcast. I'm Justin Vinieri, your host and Director of Communications at Capital RX, and today I've got the pleasure of having one of our directors on the product team, Alfonso Martinez, in the studio for what I think will be one of the more interesting, informative, and hopefully entertaining discussions about technology, specifically APIs, or Application Programming Interfaces, and Pharmacy Benefit Administration that you'll ever hear. So, Alfonso, thanks for joining me today.
Hey, Justin. Thank you for having me.
So you helped us out on the marketing team with some content a while back. It was a blog that I'll link in the show notes about modern tech and APIs. And I think we've got some updated examples, but maybe let's start off at a high level quickly. And forgive me, but I want to take a minute to just share a little bit about your background and path to Capital RX, and maybe a little bit more about your role here beyond your title.
Sure thing. So I've been in the healthcare space for over a decade now. And I've had the privilege of working with technology companies and the provider or the healthcare delivery side and the consumer or the patient side. And now, over the last 3.5 years, I've been in the payer or the benefit side, specifically pharmacy benefits. And my role here at Capital RX is Director of Product. I'm part of the product management team. And what we do is that we take the needs from our clients or from the market, and we partner with our engineering team to develop technology that supports those needs. That's product management, sort of in a nutshell.
Got it. And like I said, we'll start super high level. What exactly are APIs?
An API, or as you mentioned, an application programming interface, is a tool that allows different software applications to communicate with each other, essentially. So think of it as a waiter in a restaurant. When you go to a restaurant, you tell the waiter what you want. The waiter goes to the kitchen to relay your order. The chefs then prepare your meal and give it to the waiter who brings it back to you. Similarly, in the digital world, when one application needs to access data or functionality from another application, it sends a payload request via the API. The API then communicates with the other application to get the necessary information or to perform the required action. And then it brings back that result to that initial application or that first application.
Okay, that makes sense. And then what are APIs used for?
APIs can be used for many different things. Anything from accessing and sharing data real time to integrating applications or functionality across applications to automating tasks, enhancing a user experience, processing payments, authenticating and authorizing users into other applications, or generally, they could be used for extending a platform's capabilities with other platforms' capabilities.
Got it. And part of the reason for the discussion today, and in general, is a move to more modern systems in the healthcare industry. Is it fair to say that most Medicare, Medicaid, and commercial health plans today rely on closed systems?
Oh, yes. Yeah, this is sadly the case in the current state of our industry.
And now I'm not going to go over the top here. We're not going to go over the top here with Judy stuff, our enterprise health platform, I promise. But I do want to talk about why having a modern tech stack is important. So we're going to try and talk about this in just as helpful, educational, not salesy way as is possible. We've got well over 150 APIs available for everything from what to what, and why is that important?
One thing to note is that it's relatively easy to develop and manage new API endpoints, which are very helpful for plan sponsors or any user of a platform like Judy, because they have ever-changing reporting requirements. They have the need to access and interact with member data and claims data, and they have the need to integrate the systems that they use with systems like Judy that adjudicate claims and do many other things. They need to integrate those vendors easily. And those vendors themselves change fairly often. So if you're running a health plan, you don't want to be sort of boxed in. You want the flexibility.
Okay. Can you provide just some examples or use cases that may resonate with our listeners?
Yes, 100%. So bringing this home a little to the world of pharmacy benefits and the world of healthcare benefits, you can think of using APIs for many different use cases. So imagine a world where you can empower your team, your staff, to take action at the right time. Imagine a world where maybe a team of nurses could engage with members right after the member has picked up a drug at the pharmacy. You can do this through API-based integrations, and specifically, we support real-time claims integrations, and we support API integrations that you can tackle along with our real-time claims integration that can allow you to make that type of workflow a reality. Or imagine that you want members to know how much they would pay for a drug before they pick up this drug. This is functionality that we expose, Capital RX exposes it through our member portal, but you can expose this directly through any member experience that you already support. You can do that through drug pricing API endpoints. Or imagine you want to automate some workflows. Like, for example, you could take action when a specific reject code is triggered. When a member looks to pick up a drug, that drug is rejected for one of many reasons. You could programmatically create workflows that trigger an action based on that particular piece of information that's triggered at the pharmacy. You receive it immediately, and then you can do things. You can trigger things like send a timely notification to the pharmacist or to a prescriber, for example, or have your team make an outbound call to the member. You can do all that with the power of APIs. You can also think about not only reacting to information that happens that you can retrieve from systems like Judy, but you can also edit information. For example, you could enable your team to programmatically create authorizations or overrides to allow for members to access their right medications at the right time. You can also imagine a world where you enhance any member experiences that you might have invested in. You can allow for those member experiences to pull data and put that data directly in the hands of those members. And again, we do have functionality and we available at Capital RX that allows for members to access this data directly. But some of our clients, some of our plan sponsors have invested deeply in specific experiences that they simply want to complement. And maybe they don't want to direct the member to the member portal that I love, but maybe the plan sponsor is not interested in directing the member to the member portal, but rather is interested in showing pharmacy claims data or showing some of the functionality that Judy has directly
Like
on that
on
member experience.
like on reporting or like on an app or like to anybody basically?
Right. So on an app, for example, is the examples that's coming to mind now. Like if you have developed a really cool app for members in a specific niche and you're just interested in pulling some pharmacy information in it, APIs can allow you to do that. And open systems like Judy make it really easy for you to do that. Thinking here about other use cases that come to mind that I know our plan sponsors put in place, you can think of things like supporting your own programs, like setting up your own discount card, for example, if you happen to have temp workers, or maybe you have your own tools internally that you've either developed internally or that you have adopted from vendors and that you're not interested in transitioning out of your organization. Using Capital RX and a platform like Judy allow you to integrate those tools very easily. Or just very recently, we've enabled through the form of APIs payment processing. We've partnered with an industry-leading payment processor that is known, in this particular example, this payment processor is known for their beautifully written and well-supported APIs. And because of the ease of access to their APIs and the open nature of Judy, we were able to partner with them very quickly and develop a solution for the new Medicare prescription payment plan. And we've brought that solution to market very quickly. And we're very excited about it. And this is a fantastic sort of example of how an API-first organization can move very quickly to support the drastically changing needs for plan sponsors, in this case, for the Medicare Part D plan sponsors. So I think in short, APIs allow you to create your own path and your own experience and allow you to open up your imagination to workflows that historically have been very challenging to support.
Those are some great examples, Alfonso. So I've got a slight pivot for you, though. We hear a lot about getting to a value-based world, the potential for providing value-based care and the benefits of that. And I think one thing that comes up almost every time I ask someone about it or the topic arises is the need to integrate data, to break down silos, to pull data and vendors together to be able to do that and deliver that level of care. Is that something APIs can help with?
Certainly, APIs, I think, are instrumental in enabling that or making that a reality. And you can think of it as going in both ways. So, to sort of build and expand on some of the examples that I just walked through, using APIs, a health plan can use their own tool or tools and integrate those with our system or any other sort of API based system and enable the workflows that they need using the data from the systems that they need to be referencing all real time. For example, you can think of maybe some digital health solutions and some virtual care providers that help members manage their chronic conditions. They can integrate with systems like Judy using APIs so that they can pull data real time to engage with those patients the right way at the right time. And I do want to say, though, that when it comes to data integrations and data sharing for larger use cases like value based care, we can integrate and exchange data in a number of ways, APIs being one of them. And the way I think of these integrations is as them being leveraging different integration methodologies for different use cases. So, for example, in the world of value based care, there's a lot of analytics needed. The data that you need shared for purposes of large scale analytics doesn't necessarily need to be shared in the form of API transactions. You can integrate data from a variety of sources and in a variety of ways, not only using API, but also via larger data exchanges and integrations of data warehouses.
So it really just comes down to having an open, flexible platform. Is there a potential for Judy to be a quote unquote hub for plan sponsors, given everything we're discussing here?
Well, in a way, Judy already is a hub for plan sponsors. It already is a hub for pharmacy benefits. And you can imagine as Judy's functionality continues to increase, continues to develop, Judy becomes more and more central to the management of benefits for plan sponsors. And we're accelerating very quickly in terms of developing improved workflows that deliver the infrastructure that our industry needs to be able to operate at the efficiency that we should be operating.
Okay, great. All right. And well, here we are at the last question that I ask everybody. What's the most astonishing thing you've seen APIs do, perhaps, given the context of our discussion, or the most astonishing thing you can share? Tell us a good story, maybe something you've seen somebody try. You can take it from here.
So I think that the most astonishing thing I've seen at Capital RX, at least my years here, has been seeing our CTO, Ryan Kelly, work in an annoyingly impressive way. This individual, for those who haven't met him, will answer complex questions about pharmacy benefits on one company forum. We use Slack. So imagine a Slack channel with many, many members and many users. Answers very complex questions, and at the same time, answers very technical questions about our code base on another forum, and at the same time, responds to team-related comments of Joko's nature on other forums, all in a span of 3 minutes. It is annoying, but it is impressive.
It's almost
But
like it's almost like there's two or three of him at one. It is.
it has to
I've
be.
seen
It
it.
has to be. I'm
I've
convinced.
seen it. I've seen it. Got it.
It is incredible. Well, on a more serious note, the most astonishing thing I've seen related to APIs while my time here at Capital RX has been our ability to generate API keys for actual use, for both test as well as production or use in the production or real environment in the matter of minutes. Big props to our development team that implemented this functionality. But in a matter of 3 minutes, I can partner with a vendor. I can generate the API public and private key that vendor needs to access Judy. I can set up the appropriate permissions that API key needs to have, and I can share those in a secure fashion with that vendor or that third party or that client, and they can immediately start to support their workflows.
Sometimes you go a little over my head, but I think overall, Alfonso, it was great to have you on the show today, and you explained things in an astonishingly straightforward way. So I appreciate that, and I hope to have you back on again. Thanks for taking the time.
Awesome. Thank you.
Thank you for listening to Astonishing Healthcare by Capital RX. Head over to cap-rx.com/insights and visit the podcast section for show notes and other relevant content. If you liked this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to the show with your network if you enjoyed it. Have a great rest of your day.